Like, can diabetic people consume iCharge? That is the first question. Yes, 100% diabetic people can consume iCharge because iCharge does not have sugar in it. In fact, iCharge has only the low calorie sweeteners like sucralose, which will never increase the sugar in the body. So sucralose is having zero glycemic index, whereas the table sugar or the sucrose that we use in our houses has the glycemic index of around 70. So iCharge is absolutely safe for diabetic people. Can people with blood pressure consume this? Okay, there is another important point to tell you here. Most of the energy drinks which are available in the market contains caffeine. Everybody knows about caffeine. The normal coffee or the tea that we drink contains caffeine. See, caffeine in smaller amounts is always good for the brain as a stimulant. But when you consume caffeine on a daily basis, what exactly happens is the amount of caffeine increases in the brain, and ultimately it will lead to anxiety and depression. That is why caffeinated drinks are not good for consumption as well. So our iCharge does not have caffeine in this. So even the BP patients can consume iCharge very safely, because this will not increase the blood pressure or decrease the blood pressure, as well as it will not increase the heartbeat as well. Can school-going children consume this? Is another question that the people ask me. This is a very important thing, because school-going children are always deprived of their memory. Because of their playfulness, what they do is they don't read properly and they don't memorize properly. What I tell you is you can also propagate or you can also distribute this particular product for school-going children, which will definitely help them memorize the product, memorize the, their studies well and perform well in the examinations. Is iCharge habit forming? Definitely not. iCharge is not habit forming. You can definitely take iCharge for many days, as many days as you want to. Can this iCharge be consumed before or after food? I always suggest it can be consumed before or after food. There is no problems, but after food is always better sometimes, because some of the ingredients in this particular iCharge are well absorbed after the food is taken. So, and ultimately, these are some of the points that I had to tell you about the iCharge. I hope you are rejuvenated after listening to this lecture on iCharge, and try to, get all these things in your market, especially in the field. Try to bring in all these points so that the people will get to know what exactly iCharge is all about. Okay, so with this, I would like to end this particular webinar on iCharge. As previously promised, I will be, talking about the other products in the forthcoming webinars as well. So for this day, so I will be ending this webinar, especially on this iCharge. And if you have any questions on iCharge, please shoot me your questions on the FAQ page of our INDUS VIVA, this one on the Facebook, as well as the WhatsApp number, which is actually given on the advertisement as well. Okay, so this is Dr. BALU KOLAR signing off from the desk for today. Thank you. Hello Avids, welcome back to the FAQ session on iCharge. So we have a question from Mr. Prem Kumar. Hello Mr. Prem Kumar, hope you are doing fine. Is iCharge safe for diabetic people? So I think I have already answered this question when I was telling about this FAQs. See, iCharge does not have any sugar in it. Sugar in the sense, it is sucrose. Always there is a difference between sucrose and other sweeteners. Sucrose is actually the sugar which comes from sugar cane. That is the sugar which we normally use in our households for cooking and things like that. So this sucrose is a thing which will always increase the sugar in the body. So this particular iCharge does not have sucrose in this, but this has some low calorie sweeteners like sucralose. Sucralose is actually a sweetener which is very, very low calorie and having a glycemic index of 0. So this does not affect the diabetic people. So the diabetes people can easily use iCharge very safely. See, there is one more clarification that I wanted to give here. There are some things in the market, like there are some sweeteners, artificial sweeteners I am talking about, like the asulfame potassium, which is called as ACEK. This asulfame potassium is not suitable for diabetics because this is a carcinogenic substance. This can in fact cause cancer in diabetes people or cancer in any other common people as well. So these artificial sweeteners have not been used in our iCharge actually. iCharge only has this sucralose, which is a very, very low calorie sweetener, and it is absolutely safe. And there are lots of research papers on sucralose which says that it is absolutely safe and free from all kinds of side effects. So diabetes people can easily use iCharge without any adverse effects.